My research topic is obsessive compulsive disorder, or better known as OCD, which is an extremely heterogeneous disorder. This means that it is rare to see any two sufferers of OCD with the same overlapping symptoms. OCD is described in the Diagnostic and Statistical Manual of Mental Disorders as an anxiety disorder and is described or characterized by individual obsessions that may cause anxiety and/or compulsions which serve to neutralize a person's anxiety. My research explains the real identity of the disorder, along with the historical background and lab research, various theories and treatments included. A diagnosis becomes necessary once individual obsessions and compulsions interfere with an individual's daily function of life. Obsessions may range from such aspects as thoughts, ideas, impulses, and images that harbor over a person's consciousness, and compulsions consist of repetitive and inflexible behaviors or mental acts as well. In order to have a clear picture of OCD, there has to be a clear and true picture of both obsessions and compulsions. Obsessive thoughts can be overwhelming and foreign, and in most cases, if they are ignored, they have the potential to get worse, and they can include repeated wishes of harm, repeated urges, forbidden scenes and ideas, and concerns of bad decisions. A few of the common obsessions are about germs, sexual ideas, unwanted violent impulses, and there are numerous more. A few uncommon obsessions include fear of affairs with strangers by mistake, fear of becoming someone else, fear of calories without even touching food, and many more as well. Compulsions can be similar to obsessions, which is why people do not easily understand obsessions and compulsions. Compulsions may or may not accompany obsessions, but in most cases they do, because the compulsions help the individual with OCD to feel less anxious for a little while after performing the compulsive act that aligns with the obsession. A person with OCD has the urge to fulfill the compulsions because of the belief that something terrible will happen if it is not carried through with, and in most cases the person will recognize the behavior as being unreasonable. Common compulsions may be washing hands many times, cleaning objects repeatedly, placing items to achieve balance, locking doors repeatedly, and many more as well. A few uncommon ones are repeating words, looking at certain points in space, and rearranging letters and sentences until it spells a comforting word. 1 in 40 adults have OCD, which is a 1 month, 1.3%, and a 2 to 3% lifetime prevalence. OCD affects equal numbers of both men and women, but among children, boys have been found to have a higher rate of the OCD disorder. OCD is the fourth most common psychological disorder after depression, substance abuse, and phobias, and at one time was one of the most misunderstood disorders. The lifetime prevalence rate of OCD in adults is 2% to 3%, with the symptoms waxing and waning because of life stress. OCD can be confused with other disorders such as generalized anxiety disorder, depression, tics and Tourette's, delusional disorder, impulse control, and obsessive compulsive personality disorder as well. OCD has a history that dates back to centuries, but was not really spoke of until the European Renaissance period, the 14th to 16th centuries. During that period, obsessions and compulsions were re-examined, and the thought that obsessions and compulsions were caused by evil forces were abandoned and replaced with more naturalistic explanations. During the early centuries, OCD sufferers sought help from the people of the church. When the 17 and 1800s rolled around, the clergy concluded that it would be better for OCD sufferers to seek help from medical doctors. The treatment then consisted of phlebotomy, astrological healing, laxative and enema treatments, and the biggest change was being instituted in lunatic asylums. The 19th century concluded that OCD was not a form of insanity, but rather a neurosis, and medication began to be a treatment option at that time. There was a huge shift during the 20th century that led to a variety of new research about OCD. The 21st century still recognized OCD as still having mystery aspects, but there are great advances now. Lab research and the clinical work of OCD are not one and the same, but together they do complement each other during research. Researchers have found that there are connections that are found by combining both clinical work of OCD individuals with lab research that use sophisticated molecular techniques. Lab research has found that when a person's glutamate is out of balance, it may play a part of OCD symptoms. There is sophisticated lab work now that was not available in the past that shows why glutamate might be getting out of balance in people that have OCD. It has also been found that there is a link between OCD and abnormal functioning by certain regions of the brain. Lab research and clinical work of OCD together have alluded to better answers and new approaches to treatment. There are a number of theories that have been used to explain the clinical picture of OCD. Among the theories, the cognitive behavioral approach provides both a logical and consistent explanation of OCD symptoms. Researchers interested in the cognitive aspects of OCD found that there are three core beliefs of obsessions, with the first being the inflated responsibility of the threat, the second being the exaggeration of the importance of thought and the need to control thoughts, and the third being because of perfectionism and the interference of uncertainty. Prognosis and treatment for OCD sufferers have definitely advanced from poor to very good in a lifespan of 20 years. One of the bright sides to the advance is the development of exposure and response prevention along with proper psychological treatment. The most influential treatments come from models of the psychodynamic, behavioral, cognitive, and the biological treatment models, with each one having its own belief and treatment method. It has been found that the cognitive behavioral therapy is the most effective form of treatment for OCD. It has also been found that when using CBT combined with exposure and response prevention, that it offers both an effective short and long-term treatment for clients with OCD. The factors that influence the treatment are age, gender, race, educational level, patient preference, social support, clinical presentation, the OCD symptom theme, insight, symptoms that interfere with CBT, and of course the client's treatment history. It is true that OCD can overwhelm a person's life, but there are great advances in the explanations and treatment for OCD, and as the fine Dr. Abramowitz explained, the psychological treatment of ERP is one of the great success stories with the field of mental health. 2 years before OCD symptoms began, male OCD case study felt lonely and depressed and felt that members of his basketball team did not like him and wanted to hurt him. The male case study soon had intrusive thoughts that things around him were not exactly aligned, so in response he began compulsive acts such as cutting his fingernails until they were perfectly symmetrical, which took 5 hours each day. He realized that his thoughts were unreasonable. His family took him for help, and he was diagnosed with OCD, but surprisingly was not diagnosed with depression, but yet diagnosed with provisional schizophrenia because of some of his thoughts that he was having. With CBT and various medication, his OCD symptoms were reduced by 40%, and his psychotic symptoms remained in remission, and he was able to continue a normal life.